Hi everyone, welcome back to the Millcreek Government Channel. I'm Jessica Stutzman. If you have tuned in to our channel before, you know that we love to give some extra attention to our furry friends, the dogs, cats, and bunnies in our lives. To ensure that the pet member in your family is well cared for, we have asked Dr. Heather Palm from the Pennsylvania Department of Agriculture to relay tips on health and wellness that you do not want to forget this season. Heather is the Veterinary Medical Field Officer for the Bureau of Animal Health and Diagnostic Services. Heather, thank you so much for joining us today.
Thanks for having me.
Well, first of all, I know we're really excited to talk about how to keep our pets healthy, but I just want you to relate to our viewers the mission of the Department of Agriculture and specifically your bureau.
Our bureau is just a tiny portion of the Department of Agriculture. The Department of Agriculture's main overall goal is to keep healthy people, animals, plants in our environment in the Commonwealth of Pennsylvania. And specifically, the Bureau of Animal Health deals mainly with animal health. But there are other bureaus that include rabies law, which would do your rabies tags and your animal identifications. We also do weights and measures, so they're the groups that go out and measure your gas pumps to make sure that when you get a gallon of gas that you do get a gallon of gas. Food safety and plant safety are also included in the the Department of Agriculture.
And what are some of your duties then as the Veterinary Medical Field Officer?
Our job is mainly to prevent dangerous transmissible diseases in the Commonwealth of Pennsylvania. So any disease that may be zoonotic or means that can be transmitted from animals to people, or any diseases that might have a big economic impact on our state.
Mm-hmm. And your day-to-day tasks, I'm sure, change greatly, you know, from whatever you're working on, whatever project you're working on.
Yes, never is it a boring day for me. We do everything from, we inspect pet stores to make sure that the animals are being cared for well and that they're keeping good records of where those animals are going to. We also inspect pet crematories, pet cemeteries. We license and regulate cervid farms, so anyone who has deer that are on their property that they keep as pets or a commercial breeding program or a hunting preserve, we inspect them for records keeping and good welfare of those animals. We do all of the rabies investigations in our area, so anytime there's a positive rabid animal, we go out, we investigate, we see what animals might have been exposed to that and post any quarantines as necessary.
That's incredible. That's a lot going on for one job description.
Yes, lucky for me, I have 2 domestic animal health inspectors that work with me. Mm-hmm. So there's 3 of us that cover 10 counties in northwestern Pennsylvania.
10 counties?
Yes.
So you're traveling a lot?
Yes, yes.
Okay. And so just, you know, diving into, and we can kind of talk about the livestock in a little bit, but as far as, you know, making sure our pets are healthy, and like I said, you have firsthand expertise of this, what is involved with being a responsible pet owner?
The first thing would be to have a working relationship with a veterinarian. Even if you just go in once a year for a physical exam, you never know what emergency might pop up in the future, and having that working relationship is going to make it easier for you to get in an emergency situation when you need an exam. So having that working relationship is of utmost importance and the first thing that should be done anytime you get a pet.
And what should you look for in a vet? You know, just close proximity to your house so it's easy and convenient, or is there something else we should be looking for?
I think just someone that you feel comfortable with. Someone that, you know, not everyone has the same personality types, and I have to remind myself that I'm not going to make everyone happy. So just because I might not be the best vet suited for you, that doesn't mean that another vet out there with a different type of personality wouldn't be best suited for you. So just like you would pick your family physician, you would want it to be someone that you feel very comfortable with talking and very comfortable with the time that they spend with you.
That's perfect. And so, and I just got my postcard in the mail from my vet that my dog's annual exam is due and it's time to go in. So is once a year enough? And what can we expect from that exam?
Once a year would be enough for your young, mature dogs. Once they reach about 7 or 8, depending on the breed and depending on your veterinarian, they might be considered geriatric. And once they reach that geriatric age, every 6 months would be more appropriate for an exam for those animals, or animals that have recurring health issues. For example, an animal that is on seizure medication may be required to come in more frequently than once a year also.
Oh, okay. And then geriatric animals, does the age change from dogs to cats? I mean, I know dogs tend to be considered an elderly pet when they're, what, 7 or 8?
7 or 8 is usually about the cutoff mark that most people use as geriatric, but depending on who you talk to, they might consider, 10 or 12 geriatric for a cat because our cat patients are living, 16, 18 years isn't uncommon anymore. And then also a small breed dog might not be considered technically geriatric till 10 or 12 also because they have a longer life expectancy. Whereas if you have a giant breed dog like a Mastiff, 8 or 9 years is the normal life expectancy of that dog, so 5 or 6 might be considered geriatric for them.
Okay, so it really depends on the dog breed, which everybody, once you have your dog, you do become very familiar with what
Yes.
your breed standards and things that are typical for your dog. So during that first exam, what should both the vet and the pet owner be looking for?
The vet, you want to make sure that your vet's doing a thorough physical exam on your pet. And I always start at the ears and work my way back to make sure that I don't miss anything. And sometimes if someone brings a pet in for a specific problem, like limping on their back leg, sometimes I feel like they might think I'm ignoring them because I'm starting at the ears, but I just want to make sure that I'm not missing anything between the front and the back. So just a good systematic exam where they check all their organ systems. They're looking at their eyes, they're looking in their ears, they're checking their skin well, they're palpating their abdomen, they'll listen to their heart and their lungs with the stethoscope.
Okay, and I know when we go, and I've always mentioned this before, buying the dog or the puppy or the kitten or cat, whatever you have, buying it is not the last expense you have with the dog. So what is the average, and I know it can vary, but what is the average cost of that exam? And then I know with our exams, my dog has allergies.
Yeah.
There's always additional medication. So what is like the average cost that we should expect?
The average cost for a physical exam is probably anywhere, I would say, between $35 and $45, depending on if it's just a regular physical exam or if it's a sick visit and it's going to be a more comprehensive exam. And then the vaccines would vary anywhere from, I would say, $15 to $25 or $30, depending on what vaccines you're giving to your pets.
Okay, and you did mention the next thing I want to talk about, which are the vaccines. Are these, are there certain vaccines that are required while others are just optional but a good idea?
Rabies is the only vaccine that's required by law. So any animal 12 weeks or older in the state of Pennsylvania is required to have a current rabies vaccine. So to be legal, that is the only vaccine that they're required to have. But the American Veterinary Medical Association has vaccines that they call core vaccines. So even though it's not required by law for the health of your animal, you would definitely want to make sure that you have the core vaccinations done, which in your puppy would be your distemper vaccine, which we kind of generically call distemper, but it usually includes distemper, adeno, parvo, and parainfluenza. And then a core vaccine for your cat might be the respiratory vaccine, which we'll sometimes call just a generic distemper for cats also. And then we have your non-core vaccines, which is where working with your veterinarian comes in very handy because you'll want to discuss with them, what your pet does on a regular basis. Do they go to the groomers? Do you take them to Tractor Supply often where they're allowed pets? Do they go to the dog park? Is your cat indoor, outdoor? And that might determine what other non-core vaccinations that they might need, like your Bordetella, which is your kennel cough for your dogs, Lepto, which is a spirochete that we can see infections in dogs that are outside and maybe drinking stagnant water. Our Lyme's vaccine, which Lyme's is popping up like crazy in our area. The ticks have been bad already this year. And then for your cat, a non-core vaccine might be your leukemia virus if you're an indoor-outdoor cat that may be exposed to other cats.
And are cats susceptible to the ticks as well?
Cats can get ticks. They don't have any concrete evidence to support that cats get Lyme's disease, although there have been cases reported. I don't think that's something that they consider concrete evidence to support that.
Sure, and I know that unfortunately as diligent as a dog or a pet owner that you can be, sometimes you go out and you're walking your dog and you know, he or she, the dog, ends up with a tick.
Yes.
So what's the best way to take care of that tick?
The best way to remove a tick yourself, probably your safest best way, is they make a little tool called a tick twister, and you literally just slide it over the tick and twist it around, and it'll pop the tick out. And I think for someone who's not very familiar or doesn't feel very comfortable, that's going to be the safest best way to get that tick out of there. And then I always recommend putting some triple antibiotic ointment on that spot a couple times a day.
Wonderful. And I know we've gone to our vet to remove the tick as well, because we weren't really sure what to do. So that's very helpful. And then the rabies vaccine, you said, was the mandatory one. And what's the average cost of the rabies vaccine?
I would say on average $15 to $20.
Okay, and so these aren't, you know, great expenses, but like I said, as a responsible pet owner, you know, everybody has to know that buying the pet, that first initial purchase, whether, you know, you get it at the shelter and it's $250, that's the cheapest date you're going to get, because this all adds up over time.
And I always remind people there's no such thing as a free pet, because people think, oh, I didn't pay anything for this dog and now I have this vet bill. But it's not just important for their health, but it's also important for your health, because there are a lot of diseases that can be transmitted from your pet to you. So keeping your pet healthy is definitely an important investment.
Yeah. Keeping your pet healthy keeps you healthy.
Yes.
What are some of those diseases? Because I guess I wasn't quite aware that that could be transferable from pet to owner.
Well, we talked about rabies, and rabies is a zoonotic disease, although your pet would have to actually have clinical signs of rabies to transmit that to you. But if you don't have a vaccinated pet that's exposed to some wildlife that has it, you know, that risk is there, and it's a fatal disease. So we take rabies very seriously. To simple things like ringworm, cats are known to be asymptomatic carriers of ringworm, meaning they carry ringworm on their fur but don't actually show any lesions of ringworm. And then, you know, your kids bring home this cute little fluffy kitten that appears healthy, and then you start showing up with ringworm lesions on your skin. So ringworm would be one that we see commonly. We talked about the lepto vaccine. That's something that can be zoonotic or spread to people also, which can cause fever, it can cause kidney failure, it can cause liver failure. So it's a pretty serious disease that we can get from our pets. Intestinal parasites are zoonotic to people. So roundworm and hookworms, even though they're not supposed to be in their body, if we, you know, are cleaning up our cat's litter box or our dog's business in the yard, and we're not washing our hands properly, and we have lunch, we can ingest those parasites, and they don't know where to go when they're in us. So you can get migrants under the skin of intestinal parasites.
And I'm glad you touched on that, because I wanted people to know how those diseases were transferable too. So after you do your litter box, after you clean up the pet waste in the yard, always wash your hands. And are there any other tips you can give to that?
Even just petting your pet. Like, everyone loves on their pets and they don't think anything of it, but just petting your pet, you should wash your hands thoroughly before dinner.
Right, obviously. And then the other thing I wanted to touch on, and I see all over your website and all over your Facebook page, are about dog licenses and why dog licenses are so important.
Yes, you're required to have a dog license with the rabies tag. Dog law is the bureau that actually enforces those rules, and they do surveillance once a year. They divide up in Conquer counties, checking to make sure that dogs have their licenses. And the biggest important is that for that is if your pet were to get lost, so it can be returned back to you. Another thing that I would discuss with your veterinarian along those same lines are a microchip, which is a permanent identification. In a lot of counties, if you have your dog microchipped with that permanent identification, you're able to apply for a lifetime dog license. So then you don't have to worry about making sure that you renew that license every year.
Right, and we just did with that with our dog, and I'm so glad we did. We got her microchipped a long time ago, and I do want you to touch a little bit on the microchipping. But every year we're renewing this dog license, and you know, and It's just as simple as running down the street, to your local pet store or down to the county office to renew the dog license. But like anything else, when we get busy, sometimes you forget. So getting the dog microchipped and getting her lifetime license just puts my mind at ease, and now I don't have to worry about it again.
Yes.
So is microchipping safe, and how does it work?
It's very safe. Basically, it's just an injection of the tiny little microchip. It's no bigger than a grain of rice. And to implant it, it's just implanted with a needle. Although a grain of rice may seem small, it's actually kind of a large needle if you're looking at it needle-wise. So usually when I see a puppy or kitten, I'll recommend that when it comes in to be spayed or neutered, that we microchip them. That way they're sedated when it's done so they don't feel anything. But it's really not that terribly uncomfortable to do it while they're awake either.
Right. We did ours. We adopted ours as an adult dog, and she's a big dog. She's a German Shepherd. So when we did hers, we brought a treat along with us, and she got it done. She didn't yip. She didn't even notice it was being done.
Yes.
So as a big dog, they don't notice.
And the treat is the way to go, positive reinforcement, because if they're not getting praise and treats for being at the vet clinic, it's not going to be someplace that they like to be. So sometimes I'll have a dog that's maybe a little bit apprehensive and not happy to be there. I'll tell the owner, bring them in. If you're out for a ride and you pass the clinic, come on in, bring them in, let them sit in the waiting room, get a few treats, maybe take them over to the scale, just so it's just not always a negative experience every time they come.
That's a fantastic idea. I never thought about doing something like that. I'm going to have to start. I do want to jump back to the topic of rabies because it is such a concern and it's such a hot topic in your department. How is the disease spread from feral animals to domesticated animals? How is it spread?
It's spread by saliva of an animal that's infected with rabies. So an animal cannot spread the virus until it's showing clinical signs of the disease. And it usually doesn't start showing clinical signs until about 10 days before it dies.
Oh, wow.
So, yes.
That's fast.
Yes, rabies is scary. Once you start showing clinical signs of rabies, they're usually gone within 10 days, meaning the animal dies within 10 days. So anytime you would have if it's a domestic pet that's not vaccinated for rabies and is showing weird neurological signs, rabies should always be on your radar as to what might be going on with this animal. Or anytime you see wildlife that's acting strange. And by acting strange, there's two different forms of rabies. There's an aggressive form of rabies, which is what most people think. Right. So, the raccoon that's biting and attacking anything and everything, it wouldn't be uncommon to have them attack inanimate objects. So, a fence post outside or something in the yard that isn't alive, but they're still showing aggressive towards that.
So if we do see that raccoon attacking like a fence post, if you see that, you should call like animal control or animal law enforcement right away.
Yes, or even just your local police department to come out. Because I know in a lot of the regions I cover our country, and we don't have shooting rules where we're not allowed to, in the country situation, we might be able to just shoot that animal ourselves and submit it for rabies testing. Whereas if you live in the city, it's a violation to shoot a firearm within the city limits. So you could try animal control. You can always call your local police department to come out and take care of that animal to get it tested for rabies.
So you said the one type was aggressive, the one form was aggressive, and what's the other form?
The other is the dumb or the paralytic form of rabies. And when people think of rabies, they think they don't like water. And I think that's kind of a misnomer, and the reason that they think that is because the animals are slobbering and drooling a lot and seem to not want to go near water. But it's not that they're afraid of that, it's their muscles in their throat become paralyzed, so they're unable to drink the water and they're unable to swallow their slobber that they're making, so they just start slobbering excessively.
So those would be the two signs.
Yep.
And then, and you said it's in the saliva, so again, we normally think of raccoons, or maybe a dog has been bitten by a raccoon. What other animals should we be on the lookout for? I think in my head we are always if a raccoon's out during the day, don't go near it. Or what other things should we be looking for?
Bats. Nobody ever thinks of bats, but most of the cases diagnosed in the United States of human rabies cases are from bat exposure, the bat variant of rabies. I believe from 2004 to 2011, there were 9 human cases of rabies in the United States, and half of those were from bats.
Oh, okay.
And the other half that were not, the majority of those were actually the dog variant of rabies, and the people that contracted that had a history of travel to like third world countries. Like one was a soldier who had been in Afghanistan and who had been bitten by a dog. Another one was a missionary that had been in Haiti and bitten by a dog.
Okay.
So bats in the United States are big carriers for rabies.
Sure. So, and if your pet is vaccinated with the rabies vaccine and your pet has been bitten by an animal you suspect to have rabies, how does that affect your pet now?
It depends. If you suspect it has rabies and you safely can, the first thing you want to do is to have that animal tested for rabies. There's no live test. We only have a post-mortem test. So the animal needs to be euthanized, and then we can submit it to our lab for rabies testing.
Okay.
And then if that animal comes back positive, we do a rabies investigation. So we'll call you on the phone, we'll let you know that your pet was positive, if there were any type of exposure to that animal, and then we'll call your vet clinic to confirm your vaccine status.
Okay.
And if your animal is current on its vaccination, it'll be quarantined to your house for 90 days.
Oh, okay.
And I know that sounds horrible when you hear quarantine, but it's not quite as bad as it sounds.
Right.
We come out, we post a sign on your house just to let visitors know that your cat or dog was exposed to a rabid animal, and then just to limit the number of people that might be exposed to your dog.
Sure, sure. So if they have the vaccine, they should be okay.
Yes.
They'll just need to be quarantined.
Yes. Yep.
Okay.
They would just be quarantined and monitored for 90 days.
Okay.
If your pet is not current on his vaccination, it's a 180-day quarantine.
Okay.
So it's twice as long for a pet that's not vaccinated, and they might require a series of booster shots.
Right, right. And is that what is similar to humans? If a human gets bit by, a raccoon during the daytime, and again, you're nervous, what would happen to a human who gets bit?
Same with animals. If at all possible, we want to test that animal because human post-exposure prophylaxis is really expensive. And I know this firsthand because my dog actually got into a fight with a raccoon that ended up testing positive for rabies.
Oh, no.
And my dog had bite wounds all over his head and his ears were bleeding quite profusely. So my husband and I were trying to get the bleeding stopped before there was blood all over our house. And not thinking anything of it, even as a veterinarian, I didn't think anything of it. We got him cleaned up. I sent the raccoon off for rabies testing, and it ended up coming back positive for rabies. So my family and myself had to go get post-exposure prophylaxis.
Okay.
In the first series of shots, if a human gets exposed on day 0, they go to the ER, and you have to go to the ER. They're the only place that carry the vaccinations.
Okay.
They would get just a rabies vaccine, similar to like your dog would get a rabies vaccine, and then they would get what's called RIG, which is rabies immunoglobulin. So it's actually antibodies to the rabies virus, and depending on your type of exposure, if you have a large wound, they would inject those antibodies right into your wound, or in my husband's case, we didn't have a specific wound, so he literally got 8 shots, 4 on each side of his butt cheeks in a rabies vaccine. But that first visit cost $13,000.
Oh my gosh.
So it's quite expensive to go through this whole thing if we don't have that positive.
Right.
So if at all possible, we want to make sure we can get that animal tested.
Okay. And so preventative measures, again, stay away from, raccoons in the daylight.
Yes.
Any preventative measures towards the bats that you mentioned?
Well, anytime that you have a bat in your house that's found in the sleeping quarters, so anywhere where, if it's in your bedroom and you find a bat, that bat should be tested for rabies. Because a bat can bite you, and the bite is so little you might not even see it on your finger.
Oh, really?
The most recent case of rabies in people, I believe, was in Wisconsin this fall, and the husband had remembered a bat being in their bedroom a few months prior to that.
Okay.
So a bat can bite you while you're sleeping and you not even know it.
Okay.
So if you wake up to find a bat in your bedroom, you should definitely have that bat tested for rabies.
Okay, okay. Wow, this is just so interesting. And I really appreciate you touching on this topic of rabies, because it is so important when there's a vaccine to make sure that your dog or, I mean, the cats probably don't get the rabies vaccines, do they?
Yes, no.
They do too?
Yep,
Okay.
No, cats are required to get a rabies vaccine also.
Okay.
So yes.
All right. Well, we don't have much time left, so I just want to, touch on anything else that you feel like our viewers should know and take away with them from this show. Because I know we've got so much more to talk about, but just do you do presentations for schools or anything like that to spread this information?
Absolutely, yes. And like my goal as a state veterinarian is to promote kind of a good representation for the Department of Agriculture, because people think, oh, you work for the state, you're just mean, you're here to shut me down, you're here to do this and this and this, and we're not always mean. There are situations where we do have to, follow the rules and follow the laws, but for the most part, we're here to educate the public.
Right.
So if there's a school or a 4-H group or a vet clinic or any organization that just wants to reach out to me to do a presentation, whether it be about rabies or biosecurity or animal husbandry, I would be more than happy to do that.
Well, Heather, that was just the most interesting talk. I can't even, I learned so much today, even for, my own dog, and I used to be a cat owner, but it's been a very long time, so obviously I don't remember a lot of the vaccines I used to give the cat, but I just want to thank you for being on the show. I think this was really eye-opening for our viewers, and we'd love to have you back on the show to talk about the inspections that you do about the pet stores and the crematories. I think this is so interesting. I just wanted to thank you for being on the show today.
Thank you.
Viewers, if you have any questions, we have put Heather's contact information up online and at the bottom of the screen here. Again, if you have a pet, make sure you take good care of it. Its wellness and its health is also important to you as the owner. So make sure you get into your local vet and get its exam done yearly. And until next time, have a wonderful day.
You're watching the Millcreek Government Channel, powered by WQLN Public Media.